Hey, it's Jess from Head to Toe Health. We're going to run through a neutral position, which is a really good start for activating through the core. So placing the feet comfortably with the knees up, palms up towards the roof. So what you're going to do is, first of all, push the spine back down into the floor, just a slight amount so that you've got no air between your back and the floor. Then you're going to lift up through the back so that you've got a tunnel under here. And then you're just going to let the back drop into a comfortable position between those 2 points. So for you, we can consider that your neutral position. So from there, you want to relax through the neck. Make sure that you're not dropped too far through the chin or too extended. Just make sure you're comfortable with that neck position. Bring the shoulder blades back and down. So you're pushing the hands down and the shoulder blades together, and then settle into that position. Make sure the back is still set in that spot, so you can drop down with the spine again, bring it back up to reset that neutral position. And then from there, we're going to take a breath in and out. So just feel a couple of finger widths in from the ASIS, which is a lumpy spot at the front of the pelvis there, and then about 3 finger widths down from there. So in that position, I'll get you to do a little cough, and you should be able to feel the muscle come up against your fingers, so it'll tighten through there. That's the muscle that we're trying to tighten with this exercise. So you're going to just place a slight bit of pressure there, so just really feeling the tissue underneath, and you're going to try and contract that area without having to cough. So we're just going to go for a 20 to 30% contraction on that. You don't want to really tighten through the core because you'll shut down through the lumbar spine and you won't be able to get the mobility that you need to, and then you'll be risking injury. So just a slight contraction there, 20 to 30%, and then from there you're just going to go into your breathing. So we're going to make sure that we've got the abdomen on, the transverse abdominus. We're going to make sure that's coordinated with the diaphragm, so you're breathing while you're doing it, and you're going to contract through the pelvic floor as well. So that's as if you're trying to stop urinating. And again, that's a 20 to 30% contraction as well. So I've got all those 3 things on, and you'll find as you breathe, especially in the early stages of this exercise, that you'll probably end up relaxing through one of those areas, or you'll stop breathing or tighten through your neck. So as you go through, I want you to just run through all of those technique cues that we just talked about. So once you're comfortable with that contraction, you can lay your hands down or your arms down, hands up towards the ceiling, the palms up. So you're going to loosen through your neck, relax through the neck, make sure the shoulders are back and down as well, away from your ears. You're going to make sure that your back is in a great position. So when you're in that neutral position, try and hold it. If you ever feel uncomfortable through the back, you might need to reset that neutral position. And then you're going to check that your abdominal area is switched on. So that's the front area there. Then you're going to check your pelvic floor is on and that you're still breathing. So if you can run through 5 minutes of breaths there, always in through the nose, out through the nose, about 6 seconds in, 8 seconds out with the breaths. Keep running through that sequence until you're to your 5 minutes.